Well, we're back with part two of our Medicare discussion.
We are
There's
indeed.
just so much to talk. Just so much to talk
It's
about.
overwhelming. So,
but it's got to be. We've got to be talked about.
Yeah.
Like I said, we're on a 3-year plan, and it's getting scarier every day.
Yeah. All right, get us going again.
Okay. So it was going to be, is Medicare keeping up with the healthcare costs? Okay, if this is what, in general, no, Medicare is not fully keeping up with the rising health care costs, although the answer depends on which part of Medicare you're talking about. And it says here's some breakdowns. Many seniors are paying more out of pocket than they did a decade ago because of, again, it goes to higher premiums. I think mine now is like 172. It goes up every year.
Yeah, of course.
And many Part D plan drugs. The Part D plan drugs are the ones that are the really
cover for prescriptions.
That Part D. That's the ones that if, like I said, if you're high cost of those and that are just not.
Wow.
And then rising deductibles and copays, increased costs for supplemental insurance. Like another one that we were kind of talking about with Cindy is that you can get is the Medigap or Medicare Advantage plans. I mean, the Medigap kind of, I think it picks up what Medicare doesn't pay, or I'm not exactly how that works.
Okay.
And then again, it goes back to more expensive prescription drugs, although recent reforms have begun to reduce some of those costs, kind of like the GLP-1.
Yeah. That's crazy.
But it said doctors and hospitals, one of the biggest concerns is that Medicare payments to healthcare providers have not kept up to pace with inflation. Then that's why I think so many, like you said, so many doctors, because, but the insurance companies, I mean, you can go in, and if you're going to pay Dr. Cash, you can probably get an aspirin for $5.
Yes.
But if you have insurance, they're going to bill you. They're going to bill you $50 for that Tylenol or $100.
So frustrating to me.
And that's just not. That's just not. Is there no one watching?
I know. Why?
Like I said, you're going into the hospital $1 million and for a few days.
Right.
I mean,
that's another thing too. If you think about, okay, so maybe, one of us gets sick or something. We worked hard all of our life. I think I have a good retirement plan. I have everything, I've got my plan of, how my next, however long I'm going to live is going to look like. I've planned for it. I've arranged for it. I get sick. I get cancer. I go in the hospital. It'll wipe you out. That's what scares me.
And it's done that to a lot of seniors, and as a result, it's some physicians are limiting the number of Medicare patients they accept. Rural hospitals and smaller Medicare facilities face increasing financial pressure. Longer wait times can occur in some areas because of fewer providers participating. And my uncle found this, and the doctors gave him a list of trying to find a primary care physician to call to try to get him a primary care physician. And you go even on my Aetna website to see who your providers are. I was amazed when I was looking for a new doctor, how many doctors were not taking new Medicare patients. It's not, I thought it was just like, you just sign on. I want this one. This is good. Let me go. You call. We're not taking Medicare patients. You can go on a waiting list, a waiting list for a doctor.
I know. Exactly.
I mean,
crazy. And bringing up about that, it made me remember last time I went in for my well woman exam appointment. She asked me, because I'm getting obviously my age, she's like, are you still working? Are you going to retire or whatever? And we talk about that a little bit. She goes, well, we don't take Medicare. So it was like, so she's like giving me a heads up, that.
That's scary that doctors have that kind of conversation. We don't take. We're not going to take your.
Not
going to take in your insurance.
Yeah.
Anyway, it says medical drug. Says there have been some important improvements. Prescription drug costs. Medicare now caps annual out-of-pocket spending covered. prescription drugs under Part D, providing significant for people with expensive medications. But when they're saying they're doing that, you're still looking at their cap and like sometimes $3, $4, $5,000.
That's
That's a
unbelievable.
lot of
Oh
money
my
to
goodness, it's
somebody on
huge.
a
Fixed
fixed
income, of
income. I mean,
course.
it's
Yeah.
just. And then preventive care, many preventive screenings and wellness visits remain available, which that's true. That's like they're giving it to my little sneaker thing at the summit. They're gonna
Oh,
that's paid.
okay. Okay.
Okay, then and they're negotiating. They're trying to negotiate prices.
Hmm.
And this is what this means for seniors. Many retirees find that while Medicare covers a substantial share of healthcare expenses, it doesn't eliminate the financial burden. Common expenses that continue to incur, again, we talked about dental,
Mm-hmm.
vision, and very sad, there's no long term care is provided in Medicare. And that is just shocking to me.
Oh, it is.
That is that's just
Yeah.
shocking. Prescription medications are not fully covered, premiums for supplemental coverage, you know.
Just to talk a little bit about my mom and what we went through with her, when she had to no longer, live by herself and the dementia was getting worse and stuff and everything, and sold her house and everything. So, got her money and was able to pay for a place to live for a while. At $5,600, $6,000 a month. This is crazy, but that goes pretty fast, right?
Right.
So that gets wiped out. And so once that did, then she had to go to Medicaid, which is
That's
sad
sad.
situation, because what they offer for Medicaid is so sad. And
Right.
it's just, but sometimes you don't have a choice.
You don't.
But, we worked on this for 6, 9, maybe up to a year, all the red tape on it. It was so confusing. It was so much trouble. And my mom had all of her assets were now gone, except she had one little insurance burial. She paid ahead probably 20, 30 years ago for her cremation. Okay. Do you know that they made us cash that out? She couldn't have anything. It was only like, I'm making up a number, I think maybe $1,700. She had to get rid of that. And I was like, well, she bought this, so when she passes, it's already taken care of, but you're now making her cash that in, and then you're taking it to go towards so she can be on Medicaid. So I don't know what the answer is to this. I don't think there will ever be an answer. It just
That's
doesn't
just so sad.
seem.
It's only that said it's at our age. It's scary.
It is scary.
It's very
Yeah,
scary.
it's scary.
And it says, Medicare still enough? It says, as the U.S. population ages, Medicare faces several challenges. More beneficiaries entering the program. Again, we're going back to being
Yeah.
baby boomers.
Mhm.
Healthcare costs contribute to outpace general inflation, which
Inflation's
maybe we
pretty
say
bad
more.
right now.
Yeah, I was going to say we
right.
say more. And then
Yeah.
financial pressures on Medicare hospital insurance trust funds,
Mhm.
ongoing debates in Congress about funding benefits and providing, reimbursements. It says for most seniors today, Medicare remains an essential and valuable program, but many feel it is not keeping pace with the overall cost of health care, especially when considering out of pocket expenses and access to providers. Many Americans, Medicare is no longer enough by itself. It remains the foundation of healthcare coverage for people 65 and older, but most beneficiaries need additional coverage and must pay significant out of pocket costs.
Yeah.
That is scary.
Yeah, it is scary. And you know what? It's halfway made me joke over the last several years of, going to Canada or retiring in Europe or something. We did a trip to Portugal that has great health care. And yeah, then you have to get into the political stuff, which we won't do, of socialism or socialism
Right.
medicine or something like that. But I do know, like, my boss is from France, and I do know that his sister, a couple years ago, had surgery. Everything's paid for. I mean, it's just something you
Yeah.
don't have to worry
Well, why?
about.
Yeah.
Yeah.
How come they can do it and we can't? That's sad.
Because it's socialism or so.
Um,
So you're going to get into.
it says, okay, so what original Medicare does well? Medicare Part A and B generally covers hospital stays. Well, that's not completely. They don't cover very much, depends on
Yeah.
what you got going.
Partial.
Doctor visits are pretty good.
Okay.
Out of patient procedures, lab work and x rays. I haven't had any problems there. Preventive screening, durable medical equipment. And this is for major illnesses such as surgeries. Medicare can provide substantial financial protection. That's if you've got the right one.
Right.
But
Well, so let's talk about you personally, though, because you've been on it for how long have you been using Medicare?
since I was with the
With
first
Social
day that
Security?
it was able, yeah,
Okay.
yeah,
Okay.
62. I think
And
that's where you sign
and as a
up.
general rule, has it been okay for
I,
you
for
because you're
me,
healthy?
I'm healthy. I have had no issues
Right.
whatsoever with
Okay.
Medicare,
Okay.
but
Except your doctor that you were going
except
to
my doctor
quit taking it.
quit taking it,
Okay.
and but other than that, but I haven't had a, you know,
Yeah.
knock on wood.
Right.
I haven't had anything that's
That wasn't covered
or anything. I haven't had any major
Yeah, you
illnesses or
haven't. Yeah.
anything,
Yeah.
but just kind of like my friend, you know, if I find a little spot of cancer, that's gonna wipe that could wipe me out.
Right. Exactly. All of us.
Yeah, I
Like
mean,
most
just
people.
just
Yeah.
to check it
Yeah.
is, you know, if
Yeah.
it's, I mean, it scares me now.
It
Scares
does.
me.
It
It
scares me too.
scares me more now after doing this research and reading about it than
Yeah.
it did before. It was. I felt better before I had to think about it.
Yeah.
You
But
know,
it's not good to keep your head in the sand. And the one thing
no,
it does do, Connie, is that it might make, and I don't mean you specifically because I know you do it, but might make us all be more diligent in preventive.
right.
And go have, if it pays for your visit to the doctor, go get
Go.
your
Oh, I get
exams.
my.
Yeah.
I get my yearly
Yeah,
physical.
get your yearly
I
physical,
go
get your
and
dermatology, spots
the
checked,
things.
Yeah. Yeah.
Absolutely. Yeah, that's just really been a, especially after when I washed with my like you said, with my dad and
Yeah.
everything, that, and he was really good about
Now, did your dad? How much did you say that was costing him a month? $900.
uh-huh.
Wow! And he was paying that?
Yeah, he had no choice.
Wow!
He was just fortunate that he was part of a company that, owned a company, and
In the
that
old
he
days,
received, yeah, that
yeah,
he
Mhm.
received a little bit of, you want to call it pension or
yeah,
whatever, that
yeah,
he, contributed to.
yeah, yeah.
Um, but then this is what Medicare doesn't pay. And originally it says Medicare generally does not pay for routine dental care, most vision and eyeglasses, hearing exams, long term custodial nursing home care, which we know, which is a
Mhm.
really pet peeve,
Mhm.
long term, most prescription drugs, unless you're enrolled in the Part
Mhm.
D, routine care outside the US. Oh, that's the other problem I have. Okay, with mine, now this is kind of scary. um, if something would happen to me, I better make darn sure I'm in Texas or in Grand Prairie in my general area, because if I'm out of state or I'm somewhere else, I'm probably not going to be covered.
Even out of state?
Out of state, yeah,
Oh, I've never heard that.
yes,
Really?
yes.
That
You can.
sucks because what do
They
you want
will
to
if I
do
pay
now?
extra. I mean, I can pay extra.
Oh,
I can.
but what is the one thing that a lot of people look forward to when they're retiring? Doing some traveling.
Well, you better be healthy enough to do it. Yeah, it does not. If I'm on the road,
Wow, I
I'm a
didn't know
try and
that.
something. If I'd be in, and I think about if I'd be in a car wreck or
Yeah.
something would,
Well, you do some work travel too.
yeah. So
Mm.
that's scary. And then just sometimes it doesn't cover for routine care outside. There it's just saying out doesn't care for routine care outside the U.S. Well, that includes, depending upon your policy,
I
U.S.
see.
within state even.
Oh, I never knew that.
It says even with Medicare, beneficiaries may still have to pay. And
Wow.
then Part D premiums is just your Advantage premiums, where you do have deductions. There's co-insurance and
Mhm.
co-payments. Then again, it gets into just the cost for services. It says because original Medicare has no annual cap on out-of-pocket costs for Part A and B.
Mm.
A serious ailment, a serious illness can become expensive without supplemental coverage. And see, I do not have any supplemental
I
coverage.
see. Okay.
And then why many people buy coverage. And it says basically seniors are living longer and managing chronic conditions such as diabetes, heart disease, arthritis, cancer, Alzheimer's disease. While
Yeah.
Medicare covers much of the medical treatment expenses for medications, dental, hearing aids, home care, I think it
Yeah, and
does
to me,
not.
some of that doesn't make sense because, like we mentioned earlier, what are some of the areas just getting older? Your hearing goes, your vision goes, your teeth aren't as healthy, and those are things aren't covered.
Yeah. It's really, yeah. Anyways, the bottom line is for most retirees, original Medicare alone is usually not enough to cover all health care needs or protect against high out of pocket expenses. Many people supplement it with Medigap, Medicare Advantage plan. Like I said, I have the Advantage plan. Wish I could had the Medigap. I just, yeah, like I said, I
Are
just
you able to make changes? Are you able to
once a year.
once a year? So
Yeah,
if you
you can
decided,
change, yeah. And it's as many people like, like you said you
hmm
did, spend years planning for retirement,
yeah,
but are surprised by how much certain healthcare costs add up. And they hear of the expenses retirees most often say they didn't anticipate. And it's just many retirees, assume Medicare covers nearly everything, but they still pay for monthly Part B prescription drug plans, deductibles, Medigap payments, and you got your prescriptions
yeah,
again. You just go on that you just dental care,
yeah,
hearing aids. There's just so much
yeah.
that and like I said, my pet peeve that scares is the fact that there is uh, you know there's just no help with assisted living, memory
Yeah.
care, extended nursing home stays, and even ongoing in-home
And
personal
that's
care.
what wipes people out too.
That's where
That's what,
that's like I said,
yeah,
as long as you're healthy and
yeah,
you're doing
uh
well,
huh,
Medicare is good.
yeah,
Like I said,
yeah,
I have no complaints at
yeah,
all.
yeah,
But once
yeah.
something goes
Or
wrong,
if you develop dementia or Alzheimer's or just,
Alzheimer's,
yeah,
or
yeah, could
have a
wipe you
heart
out and
attack, or
just,
if I'm going to have to
yeah,
go in and be in the hospital
yeah,
for
yeah,
a month,
yeah,
or you know
yeah.
in they're talking about the other thing too that they don't really look out for, and that's like we've said about sometimes the need to be nice for Medicare to if they would like walk in showers, grab bars,
Mm-hmm.
wheelchair ramps, stair lifts,
Yeah,
wider doorways. These
yeah,
are things important just to survive,
yeah. Right, right,
that
right.
you don't
Yeah.
that just don't happen. And it says beyond Medicare, retirees may face Medigap premiums, Medicare Advantage costs, long-term care insurance premiums. So you can get all this stuff,
Mm-hmm. You
you
just got to
know.
pay for it.
You gotta pay for it.
And I think when people are thinking about retirement now, now it scares me when I'm doing my little spreadsheet to see, okay, I'm not working anymore, and maybe I've paid for, I've worked hard to pay off my house, and I've paid off all this, but man, you better have a big chunk of your retirement income going towards healthcare.
And you got to really think. Things in our generations also really uh change. Of course, next week we may talk about on the effect of inflation and how that there were things going up, and how
Mm-hmm.
the costs and it is now what's going to be like when we're ready to retire,
Yeah.
in 2030 or whatever. And there's the says many retirees don't expect to spend money, and this is what we do. And I am really bad at this. This one hits home with me, is the fact that I'm capable of doing it now while I'm working, but it says to help, and I don't support my children, but
Mm-hmm.
if they needed something,
You would.
I would be the first one to do without, to make sure that they had something. But you
Yeah.
don't, it says they don't expect, sometimes you have to help support your adult children.
Yep.
You have to support your grandchildren. How many times do my grandkids
Yeah.
call me and say,
Yeah.
you
Can
know,
you help me
I'm
out a little
I'm
bit?
going,
Or
yeah, they're in
yeah.
college, and
Yeah.
mom says she's not going to pay my cell phone,
Yeah.
or
Yeah.
I'm just between jobs. Can you order me a pizza? Can
Yeah.
you
Yeah.
send me $20 for
Yeah.
groceries?
That's gonna hurt to not to be able to do
And that's
that.
going to be that really
Yeah.
is. And be prepared for just everyday family
Yeah.
emergencies let me tell you, emergencies if you've got a poor pet, which is like your
I
family.
know.
I mean, the cost of that alone is
Yeah.
absolutely
Yeah.
is astronomical.
Yeah.
And these are things that are happening, that inflations
Yeah.
that we don't
Well,
expect.
and then you got to think about you own a home.
Yeah.
So
And
you're going to have home repairs.
you're going to have home repairs. You're
Yeah.
going to have
What
your
about your vehicle?
homeowner's
Yeah.
insurance,
Yes.
your auto
Property
insurance. Things have
taxes.
gone
Yeah.
up. I
Mm-hmm.
mean, it's just right now. It is
Yeah.
skyrocketing.
Right.
I mean,
It
it's just
is.
gotten homeowners insurance
Oh,
is just crazy.
yeah. I know we get a property tax exemption, a homestead exemption on property taxes. I wish that we could lobby to have, over 65 or when you retire,
You
you
don't
don't
have
pay
to pay property. I have
Yeah.
no kids in school.
Yeah. I know
I mean,
exactly.
I'm not
And that
taking.
goes up. Oh my
Yeah, if they would
gosh.
even do away with
I mean,
that.
you work so hard to pay off your house or whatever, but then, you still you're always going to have the insurance,
Right.
but at least, get some relief from property taxes or
Yeah.
something. Yeah.
So I hope everyone will join us next week. And let's talk
We
about
better
it.
go lighter again next
I
week. I mean,
know.
now,
Yeah,
these are all very important topics, but man,
you got to. Like I said, when we were doing research, we're really trying to dig down and get the
yeah,
information. It was really hitting home with me because
yeah,
it sure made me stop and think. And
yeah.
it's like I said, it's
And
scary.
as
Your
much
life
as
can change in a second.
That's right. And as much as we look forward to our next chapter in our life and our retirement that's coming up and stuff in a few years, it's also very scary now because now you don't have, the security to fall back on
No,
of a job if something happens or whatever.
right when it's gone.
And the fear if something happens and you're wiped out.
No, because
So,
it's not going to take a lot.
yeah. So,
All
okay.
right. Well, stay tuned. We'll see you next week. Have a good week. And thanks for joining us.
Yeah. Thank you.